I am truly worried that this information is getting so easily to obtain through ChatGPT to the point where it sounds convincing. And unfortunately, here in the United States, they can smuggle in medicine. Or another thing that really made me so sad is the AI giving advice to how to lose weight, and then them going on some website and they're actually not getting the GLP ones. They're actually getting insulin shots, and they're dying from low sugar because they're giving themselves medicine. And so that just breaks me as a human being, thinking, oh my gosh, we need to do something like yesterday. We need to be. So I'm trying to be that voice.
AI isn't just for tech bros, it's for you too. Welcome to Yalla Now AI. I'm Melek, a tech executive and serial entrepreneur.
I'm Rima. I'm an author, entrepreneur, and an educator. On our show, we're going to bring you real talk, real solutions, and plenty of laughs to the AI conversation. Yalla, let's go.
Welcome back to another episode of Yalla Now AI. And today we're delighted to welcome a real innovator and pioneer in the AI space. Rima and I have a very special guest by the name of Dr. Harvey Castro. Dr. Castro joins us today as an ER physician, a chief AI officer, an entrepreneur, a futurist, and a patient advocate. Dr. Castro has had several TED Talks where he's spoken about AI in healthcare, and today we're going to dive into some of those in greater detail. Dr. Castro, we're delighted to have you with us.
Such an honor to be here. I appreciate it. I'm glad you and I met in my hometown of New York City, and it's been fun. So thanks for having me.
Well, one of the things I was delighted to know, what I kind of knew a little bit about you before we actually met, is this nickname you have of Dr. GPT.
Yeah, I got to give you the backstory. So in the year 22, I wrote the first book on how do we use ChatGPT in healthcare. And it was a public service announcement. It was just more like, let me write this book, let me give it to my colleagues, my patients, and just understand this thing called ChatGPT. And as a result, that book went viral. I'm now an advisor for the country of Singapore. That put me on world stages. And as a result, one of the audience members was like, man, you're like Dr. GPT. And when he said it, I was like, whoa, I actually like that. So I went as far as trademarked it. I started hashtagging it. And then I went ahead and made a little pin. And like every time I go on stage, and pretty much now, if there's any networking event, I wear it. And it's been fun.
That's a great branding. So true to who you are and who you've become in this space.
Thank you. Thank you. Appreciate it.
So tell us a little bit about the origin story of Dr. Castro. What was life like before, I think it was November 2022 when ChatGPT became publicly available and we all started experimenting with it. What was life like for you at that time? And what was your interaction like with AI?
Yeah, such a good question. I hate to go back too much, but literally, I come from a humble beginning in New York City and always been this kind of, I call myself a little bit of a nutty professor. At one point, while in high school, I started my first business and I was looking at vitamins, and I literally started a subscription program with the high school friends of mine's parents. And I made so much money with my business that I was making more than my mom, more than my regular day job. And as a result, I thought, man, I'm always into gadgets and ideas. Fast forward in medical school, I started writing books for medical students and how to leverage different parts of medicine and different books. I literally was advising all these book companies, and they were giving me free books. And as a result, I would look at all the books, kind of like AI, grab all that information, and then extract what I thought was important and then sell that. And then fast forward residency, I thought, oh my gosh, nobody really understands vitamins. And there's so much literature now on it, but no one's really pushing it. And I thought, I'm going to create a heart vitamin formula with all the science behind it, find a cardiologist because I was just a resident. No one's going to listen to me. And that label went national. And so where I'm getting to is at one point I owned emergency rooms. I had 400 employees, 8 locations, hospitals, ERs, staffing, billing, and as I looked at my life was flashing through, I thought, man, if I had ChatGPT within 5 minutes, I was in this office and it had just been released. I'm playing with it. And within 5 minutes, I'm like, whoa, my whole life that I just mentioned briefly flashed. And I said, if I had this tool, whoa, things would be amazing. So I thought, let me write this book on how can we leverage this technology. And since then, now I'm literally working on the second edition because so much has changed.
It's remarkable, the pace of change.
Yeah, absolutely. Dr. Castro, you've built emergency rooms, staffing companies, and now you're bridge AI with medicine. What I'm hearing you're constantly building. So, what drives somebody to continuously rebuild and build rather than settle into expertise?
That's a good one. I love entrepreneurship, and I know you two guys love entrepreneurship. For me personally, I have a very strong why. I came from a teenage mother who gave me the tools of success, but then didn't give me all the accolades and financial backing and all the other things that some other people have. But that was the best blessing for me personally because it created into my DNA this out of the box thinker. How can I push? And not that I'm not satisfied, I'm satisfied all the time, but I keep thinking, what can I do with these gifts? What can I do with all this knowledge? And then I go back and look at my strong why, and it just keeps pushing me because often my friends are like, dude, you've done enough. You need to just chill, go on vacation, and just like stop. And I'm like, what a waste for me personally. I was like, no, I want to build, I want to create. And then the heart of a physician really pushes saying, no, I really want to serve humanity. And I think that's another strong why that I keep pushing.
I think that's something Rima and I really resonate very strongly to what you've described. And knowing your why, I think knowing the businesses that you're in and the kind of impact that you're having, I could see that. I could see that sense of continuing to give and having it show up for people in meaningful ways. So tell us a little bit about, you sit in a unique position as a clinician who has, worked in the emergency room, seen patients in their most vulnerable states, as well as, on the other side of actually taking care of the patients after they've come through that, really difficult, urgent moment. What are some of the things that you think patients could do to help themselves be better informed or be better prepared
Hmm.
for an appointment, for a procedure, leveraging AI?
Yeah, love that question. Before I answer that, I just want to go back for 2 seconds. That earlier question, I wanted to add one more key point. I literally was reading this yesterday and it really hit hard. It said, whenever you get to a certain level of expertise, and let's just call it you're at the top of your game, quote unquote, often, if you're not careful, you become very comfortable. And when you become very comfortable, you don't continue to grow. And as a result, you're no longer at the top. And this thing I was reading basically said one of the advice is to literally leap out of that vertical, go into another vertical, start low, and start growing again. And I thought, whoa, what a great advice. And I just wanted to share that with everybody because I know there's some entrepreneurs listening. Now, to your question, as a doctor, I feel so blessed to be able to have that gift. And then I thought, if I understand technology and I can think outside the box, why not combine my talents? And I'm not trying to brag or anything, just being a doctor. I went back and got my MBA. I've had multiple businesses, so now I have those two verticals. But I've always had this entrepreneurship mind. And it really boils down to what is the pain point and how can we fix that pain
Mm-hmm.
point? So then I put all three together. And now that I answer your question, I see so many problems in medicine. I don't feel that it's to me, in my mind, it's more of the workflow, it's more of the culture. And to attack it, how do I help my patients? Well, if there wasn't a problem, patients wouldn't go to Google, wouldn't go to MD Consult, wouldn't go to ChatGPT because it's already solved. There's no need. But because the patients, as we before we got on, we were talking about patients listening to influencers and other people that may not have the credibility or understanding of the bigger picture, or they're playing with fine lines where they're giving medical advice and people are looking at them as an authority figure when really they may not know the science or give good advice. And no disrespect to any of them. Sometimes they say things amazing and sometimes, no, I can't, but and all of them. But the state of Texas has vetted me with giving me a medical license and my expertise. And so how do I do this for healthcare? One of the first things I did, it was called MediHelper. And the skinny is this: the average patient only spends 13 minutes with their physician. And if we think about it, back in the old day, I'm going to age myself, patients would come to the doctor and that was their source of information. That was all of it. And those 13 minutes was A to Z. So then I thought, if patients are already reaching out to other sources, what if I created a GPT that allows the patient to put non identifiers in it, like there's like 18 of them, but like your social security number, your date of birth, your name, address, phone number. They just put in their issues. I have hypertension, I have diabetes. I'm going to see my Dr. Castro for my annual visit. What should I ask? Now the AI takes all of that and gives a nice structure of, here are the top questions, here's some follow-up questions, here's things that you should consider. Let's look at the following things, and this is probably what he's going to ask for, so let's have it ready. So now those 13 minutes with the quote-unquote expert is much better. Instead of going back and forth, how was your weekend, which is great, do you like the game this weekend, whatever. Instead, let's talk about why you're there. Let's talk about your diabetes and hypertension. And I thought this is the best way early on to leverage the technology with our healthcare and our patients.
So that's a GPT that you created.
Mm-hmm. Yeah, and it's on the ChatGPT, and I'll give you the link so that you can share it in the comments for everybody to just check out.
That's great. And just, non-personal, make it anonymized data. Anytime, just as a disclaimer, anytime you're putting in health information into any of the AI tools, unless you know for sure that it's HIPAA compliant, please don't put in your personal identifiable information in there. But that's so powerful, because I think about the amount of opportunities that a patient has for that face time with their physician. And so often there are many things in our minds before we get to that seat in that room. So the idea of having a preparatory conversation or a preparatory plan with your AI seems really powerful and had the ability to transform that 12-minute, 13-minute interaction.
Yeah. Dr. Castro, as a strategic advisor for ChatGPT in healthcare, what keeps you awake at night about AI adoption, and what gives you the most hope?
Good question. That's a good one. What keeps me up at night is more on the patient side. It's not really as much on the physician side, because I'm hoping that the governing body that gave them the license to practice medicine is making sure that person is practicing medicine. With that said, I'm with the Texas Medical Association helping lobbyists and creating different platforms to educate our physicians around the world. And I'm literally giving talks to make sure that they're solid. But at the end of the day, I know they have that base knowledge of medicine and they do no harm oath. On the patient side, it's another story, and that is what keeps me up. I am truly worried that this information is getting so easily to obtain through ChatGPT to the point where it sounds convincing, where unfortunately, like a child could be on a chatbot thinking this is a friend, and we're hearing multiple stories of people committing suicide and the child crying out for help, saying, I need help, and the bot at times saying, well, just end it. And I'm thinking, oh my gosh, no. And the other part to this is people are self-diagnosing. And in some parts of the world, they're able to get certain medicine. And unfortunately, here in the United States, they can smuggle in medicine. Or another thing that really made me so sad is the AI giving advice to how to lose weight, and then them going on some website and they're actually not getting the GLP-1s. They're actually getting insulin shots, and they're dying from low sugar because they're giving themselves medicine. And so that just breaks me as a human being, thinking, oh my gosh, we need to do something like yesterday. We need to be, so I'm trying to be that voice. I'm trying to be that. anchor, like, let's do this right, but let's keep that human in the loop, and not just any human, let's keep the right doctor. So if you have a diabetic question, let's use that family practice. If you have a derm question, let's use the dermatologist to just check that to make sure it's safe.
Is there any specific tool that you think has done a better job of, credible sources that the system has learned on, and really addresses these open questions that a patient might have better than another?
That's a hard question.
Hard to know.
Yeah, that's a hard question just because technology is just changing so quickly, and there are some models that are starting to be trained, and they're going into what's called the foundational model, meaning it's going into Google Gemini, it's going into ChatGPT, but we're not there yet. So are we at that place? Not yet. Now, and that's why I said I'm not worried about the doctors. I'd rather the doctors use those tools and then use their clinical gestalt to say, you know what, this is wrong, this is right, I actually like this idea, let me explore. And on the patient side, I think we will get there. I think there's some verticals of some things that can, but for now, because healthcare is not like picking a stock where if you lose money, you lose money, like literally this can kill someone.
Yeah.
I think there's too many factors involved that we must have a doctor in the loop or that right healthcare expert in the loop to make sure that we do this safely.
That's really something to think about.
Yeah.
You
Yeah.
know, we think about the power of AI and what it means to democratize access and information, but really some of the pitfalls on the other side of that.
Yeah. Um, this segues really well in something that I've been meaning to ask you, Doc. So you've stood at bedsides making life or death decisions, and now you're shaping how AI enters into those same rooms. How do you reconcile the intimacy of medical care with the scale of technological transformation?
That's such a good question. So, see, AI isn't replacing doctors. It's replacing what slows doctors down. So how would I integrate it, or how does that human touch? It's literally, you trust me if I was your doctor. You trust our conversations, the way I present, the way we interact. If I had a robot come in and say, oh, the robot's going to take over Dr. Castro and just talk to the robot, you'd be like, whoa, whoa, whoa. No, no, no. Where's Dr. Castro? But the way I see it is the following. Let's role play for a second. Let's pretend that I got your consent to have that robot next to me, literally. And we're having the conversation. And what I just said was, it's not replacing me. We're going to replace what's slowing me down. What slows me down and adds cost to healthcare is not knowing what I don't know. Example, we're in the emergency room. You're coming in at 2 a.m. You said you had all these labs, x-rays, CAT scans done, but it was at another hospital. I can't get a hold of that hospital. I can't get the records. I have to recreate the wheel. I have to order everything that you just paid all this money for. But then there's some tests that I don't really need. And then if I'm not, let's just say, I'm trying not to order them, but I don't have them. But here's where I'm going with this. If the robot can now be my second set of eyes to see what I can't see, meaning, I have a whole TED talk on this, leveraging its vision. Let's start with that. And then I would have these, I'll pull them out. I have these meta glasses that have a screen on here. And as I'm talking to you, the robot can be giving me feedback, saying, hey, Dr. Castro, you forgot to look at her ears, and here's the possibilities. And if you don't look at her ears, you may miss this diagnosis. And then as it's talking, it's saying, hey, Dr. Castro, we don't need to order that lab right now because we're showing elevated levels of her sugars just with her speech. And so then I'm like, oh, she might be a pre-diabetic, or maybe she's a diabetic. And you see, now it's really helping me because now I'm not just taking care of you. The robot is helping, and then helping increase the time. And in the ER, when seconds count, that's one example how it literally can save a life.
Dr. Castro, this robot that you're describing, is this a future state? Or is this something you've already put into place? Or tell us a
Yeah,
little
that's a good question. The robot I've been talking about for years, the technology is here. I truly think we will see it in 26, some level of it. because the dexterity of the hands has improved, because the physical form of the robot is existing, and you add AI to the brain of the robot, now everything you know about AI can be in the physical place. And I know that sounds Terminator-like, and it sounds really scary, but in my heart, in my eyes, I see it as a physician. Case in point, the US and around the world, our population is aging. We don't have enough physicians, healthcare professionals to serve this aging population. Sorry about that background noise. It'll stop here in a sec. And as a result, I truly think we need something. To me, that something's AI and robots. And then the clear example is, I know this sounds kind of odd, but what if we had a robot helping our elderly? I'm not trying to replace the physical touch. I'm just saying a robot that can keep an eye on grandma to make sure that she did take her medicine, that she didn't take it twice, that it detects proactively to say, you know what, I'm hearing a change in your voice. I think you're actually having an early infection. Let's check this out now before grandma falls, breaks her hip, and unfortunately dies 6 months later.
Yeah, I was just having a conversation with a friend about the coming care crisis and really how it's going to impact our, not just our immediate lives, but our economy, what it's going to mean. I mean, I think about my team and my employees and how often just in the last year, they have had to call out because of a mother who was sick, a mother who fell and couldn't get up by herself, needing to research skilled nursing facilities, all of the things that go around this care idea or care needs for a parent, never mind the care that is being given to their children. And, for many of us, it's happening in both simultaneously. So the idea of having a physical supportive tool to aid with that would be really powerful and transformative. I think that would be a welcome helper, a helper, not a replacement, as you said, but a helper in many families' eyes.
Yeah. Yeah, I think it's so important. As a physician, I say let the AI inform me, but then ultimately let the human, my clinical expertise, my clinical gestalt, decide to see if that is correct or not. And I think it's all about human plus AI. How can we leverage and knowing how to leverage and when not to leverage. Quick example, if the AI is biased in XYZ, knowing as a physician that it's biased in XYZ and not propagating that bias because I know the tool, because I know this AI as a food label and I know what's good, what's bad, what are some of the bias, and I can say, sorry, this particular AI doesn't apply to you because of this particular bias. We cannot use the advice from this AI.
That's a good point. We didn't even touch on that in terms of the historical training data that the AIs have been learning on and some of the biases and overlooked populations.
Yeah.
We had a previous guest on, Dr. Castro, who spoke about, women's health and how so much of even like the clinical data, the clinical trials for so many decades didn't include women at all until I think it was in the 90s at some point when
Yeah.
women were no longer viewed as just smaller versions of men, and what it means as a patient to interact with an AI tool that may have those biases, and how do you, again, thinking about it from the patient lens, which how do you mitigate that, or how do you plan for that so that it isn't, or you reduce that possibility for yourself and your interactions with the AI.
Yeah, so important. Yeah, and that's why people ask me like, how do you fix that, Dr. Castro? And I really think one of the ways is we need to reach out to our government leaders. We need to reach out to our billionaires out there and say, hey, we don't have this data set on this population. And if we're not careful, this other population is going to live longer and better. And then this population here is neglected. And we need studies to make sure that we can address this population so that it's equal access to everyone around the planet and we all live longer and we all live better.
That's the whole promise and hope of democratization, right? Democratization of access, of information, of tools like the AIs. So that's a great call to action for all of us.
Yeah. Doc, you've shared a little bit about your upbringing, and thank you for being authentic and keeping it very real. Me and Melek are proponents of that, of really sharing and how that benefits others as they're listening to this. So, your lived experience, how did it shape how you think about AI's role in addressing healthcare disparities and reaching underserved communities?
Yeah. So when I think about this, I feel like the future of healthcare really belongs of who's designing it, not those who are reacting to it. And so how can we leverage this? Forever I've been at one point I was speaking in Africa and I got lucky to meet some world leaders there and I was telling them, hey, what we need to do is give access to rural parts of the world and rural parts of Africa. And what I had suggested to them is let's try these trailers to put them out in the villages where there's zero internet, there's zero infrastructure, and then let's piggyback these trailers to have connections with satellite to give the internet feed to it, and then let's have computers in the trailers so that way we can have patients coming in interacting, but we have that human in the loop. We have that maybe a PA that is there to help be that access for that region or for that village. And now they're leveraging technology. The human in the loop is that PA. And if that PA doesn't know XYZ, then they can contact a physician expert. And now it's giving care to those villages.
Dr. Castro, it's been a very eye-opening and informative conversation. I'm sure we will have you back because I can imagine that there is much more to unpack. I mean, certainly Rima and myself are just on our own heads and ideas, but I'm speculating that our audience will have much more that they'd like to dive into with you as well. But as you know, we have a couple of standard questions that we love to ask all of our guests while they have time with us today. And so now we'll segue into that. Are you
Sounds good.
feeling ready to dive into those?
Let's do it.
Okay. So the first question is, Rima and I both have a thing about bags, and we love to carry our bags and all of our essentials with us. So if we were to search your bag and fetish through that, what would we find?
That's funny. You'd probably find a bunch of chargers for all my
Chargers.
wearables. Chargers, and you would find different smart edge devices like an iPhone, or I literally just ordered this Kindle device that I really don't need, but it has a color PDF. I haven't received it yet, but then what I'm thinking is I'm gonna leverage all my files, my information. I could do it on a laptop, but it's just a small, and then I can write on it and save on it. And I thought, okay, this is like perfect for me because I'm constantly thinking of the future and posts, and like if you guys said any book, I'd be getting it, fast forward, reading it, and then seeing how I could apply that concept into any vertical. So those are the things you'd find in my bag.
All right. A man with his chargers on the go and his smart devices. I love it. That checks out.
All right. So our second question for you, Doc, is what's your favorite snack?
Okay, I'm on a health kick, guys, and I want to be around for my grandkids and my great grandkids. So I am trying to eat more protein. And
Okay.
this wasn't, you didn't tell me these questions. So literally I have this next to me and it's just
Oh,
nuts and it's protein. And this is when I get a little hungry throughout the day, I have it. And the other little gadget is I have a little Stairmaster underneath here. So if I'm working on the computer for a while, I can still make my steps and just trying to stay physical.
love it. I can relate to the little gadget under the desk. I have a treadmill. I don't walk on it while we're recording, but most of my other meetings I take while walking, and it's been a game changer.
Hmm.
Yeah, I'm not one of those people. I have snacks under my desk. I don't have those Stairmasters. Yeah, just saying, just saying.
Diversity is a beautiful thing, Rima. We need several different types.
That's right.
I can't imagine. I see her, and sometimes she'll be on a call on a Zoom, and it's work, and she's doing her I'm like, how is this happening? So
I have to get those steps in, otherwise it's too much sitting. Okay.
Exactly.
And final question is, tell us something that is making your life better.
Yeah. Something that's making my bad life better. I hate to sound repetitive, but honestly, I am so into AI that I
Okay.
am doing AI for everything, and it's making my life better. And I love teaching, and I have to give you this quick story. You guys are gonna laugh. I'm
Okay.
into AI so much that for years I have been training my mom, telling my mom, "Hey, do this hack, do this, do that." And she's gotten to the point where I feel like she's in the top 1% for her age group of understanding and applying AI more than most
nice.
people that are retired. And so I have to give you this example. This is like, I'm so proud of my mom. Over the summer, she came to visit and we heard this big crash out of the bathroom of glass. And I was like, what the heck? So we run in there and I'm assessing, it was my shower that was glass. One of the panels just like crumbled and I've had it for years. It's just spontaneous. My mother, so proud of her, she says, Harvey, take a picture of all the angles of the glass, of the situation, upload it to ChatGPT. Let's figure out why this happened. I was like, whoa, mom, you freaking rock. I was like, you are the best. I was still like processing, like, what the heck happened? And my mom's like, look, here it is. This is what you're going to do. And it told me what had happened and why it crashed and all that.
So
I was
your
like,
mom, as the student, became the teacher.
yeah,
Yeah, we need to get her own YouTube channel, Dr. Foster. She can lead the charge for
You lead to the, exactly.
really,
send me this segment because yesterday, literally, I was telling my mom, I'm like, Mom, you would be like the best influencer and you're bilingual. Then you teach the Hispanic population
Exactly.
all these things and they're going to respect it because it's coming from you and you're older and they're going to be like, whoa, if she can do it, I can. I was like, Mom, you got to do it. And she texted me back. She's like, ooh, this might be something I want to do. I'm like, yay. So she may have a channel.
Sounds like AI con abuela or abuelita, right?
Yes, yes. Oh, and then a shameless plug, real quick. My mother is an ultrasound tech, and she inspired me because she went back to school when I was in high school. But she's been doing it for over, God knows, like 30 something years. And so here's the thing. I met a company called Pons AI out of New Jersey, and the skinny is they have predictive analytics of ultrasound, and they're doing all this AI stuff, and they'll be at CES this year. And what I'm getting at is I'm an advisor, and I told my mom, I'm like, Mom, you have so many years of experience and you love AI, come in on as an advisor. So she just signed up as an advisor. So I'm so proud that I get to be with
Oh,
my
I love to
mom.
hear
We're
that.
both advisors. I'm like, oh, what a cool story, you know?
Yeah, let her get that bag. Let's go.
Yes,
Yes.
Love to
yes.
hear that. Well, I think maybe there's a future in which Mama Castro comes on the episode.
Well, we have a book together called A Success Reinvention, and it's a book she and I wrote together. And I've had two film producers asking me for the rights to that book, so
Yeah,
that should be coming in the
you
future.
could bring Mama Castro on this. Seriously.
Yeah,
Yes,
we're gonna book that for later in the year.
that'd be fun.
Um, Dr. Castro, you've been so generous with your time and your knowledge. We're so grateful for everything that you've shared. If our audience wants to learn more about you, where are the places? You've got a few of them to
Yeah,
keep up with.
I would highly encourage everybody, whatever social media you guys use, literally type in Harvey Castro MD, and that is the same tag on all the major social networks, and follow me. Second, I would beg you to please watch my TEDx talk. Just again, go on YouTube, type in Harvey Castro MD TEDx. You'll see 5 right now, and they're all about how I see the future in AI in healthcare and how can we help humanity. And if you can, it helps the algorithm put a little comment of anything that if you like or don't like, that's fine. I just
Mhm.
want you to see it. And then the last is my website. If you're interested, it's harveycastromd.com. And on there, I have all my speaking gigs where I'll be around the world for 2026. So I appreciate the time. And thanks, guys.
Thank you so much, Dr. Castro.